Durvalumab is a PD-L1 inhibitor. It's a drug which has been developed in bladder cancer over the last 2 years. 1108 is the pivotal trial to achieve FDA approval. It's essentially a very, very large phase 1 trial, as we've seen before with other drugs in this area, where there is a fixed dose is established, and the dose is then given to an expanded cohort of patients. These have urothelial cancer or bladder cancer, and it's showed very quickly activity, as we'd seen with other drugs previously. And for that reason, the cohort was expanded. The trial initially looked at individuals who only overexpressed the PD-L1 biomarker. The biomarker, the companion diagnostic with this drug, is the 263 biomarker. Each immune checkpoint inhibitor has its own individual biomarker, so that's complicated the field with 5 biomarker programs. But this biomarker, in the initial part of the analysis, during the exploratory phase, showed really promising data with very high response rates and quite high sensitivity and specificity. And for that reason, the biomarker was, the cohort was expanded to test the negative population as well. And the last part of the trial, therefore, is we then looked at essentially all comers and then retested the biomarker to see how accurate it was as a sort of a test and a validation phase. When you look at a population now, which we've just published very recently, has been accepted for publication in JAMA Oncology, when you look at the cohort that we've tested, we've got accurate efficacy data on now on over 100 patients. There's a degree of selection in that. But if you look at the response rate in the biomarker positive population, it's in the region of 30%, 20% in the all-comer population. And that looks very competitive compared to other agents. The drug is really well tolerated, and the responses are long-term and durable. And the overall survival, I'm always nervous about talking about overall survival in phase 1 trials because there's a lot of patient selection. But if you look at the overall survival of this cohort compared to historical controls, it's longer than you would expect. And we clearly hope that's going to translate into a survival signal in the randomized studies. There are issues around dose delivery, so this was given 2 weekly. In some of the subsequent studies, it's been given on a 4-weekly schedule. Durvalumab's been approved by the FDA in the last 2 months. Durvalumab is a drug which has been approved in individuals who've previously failed platinum-based therapy. That's very similar to the approval of other agents in this setting. The biomarker is something which is being developed, but is not a crucial part of the approval, so it's an all-comers type approval. We've used a lot of Durvalumab in our centre. We probably have treated 20 patients with Durvalumab now. And what we're seeing is we're seeing a well-tolerated drug. We're seeing a drug which patients are receiving. We've had long-term durable responses, as you would expect. We've had patients who progressed through the drug as well. So it's very much in line with what we would expect to see and similar to what we've seen with other agents. And it's not until we look at the randomized trials will we be able to determine whether or not there's any difference between these agents, which is why studies like Durvalumab in the frontline setting, testing single agent Durvalumab and tremelimumab together versus all-comers chemotherapy in over 1,000 patients will potentially change the way we see the disease in the future.